This is Leslie Sanchez conducting a head-to-toe assessment for my class N495 Aspen University. Do you consent to this head-to-toe assessment solely for the purpose of N495 Aspen University class?
I do.
Okay, just know that this head-to-toe assessment is solely for the purpose of my skills and is not to be used for any future or health recommendations. Do you understand?
Absolutely. Sandra Santana, date of birth, November the 27th, 1977.
Okay, and we have already washed our hands, so we will begin the head-to-toe assessment. Okay, first we're going to inspect the head and the neck. We're going to check for any abnormalities. We're going to check for symmetry, which is normal cephalic. We're going to check for the temporal arteries. We're going to work our way down and palpate the carotid arteries intact. We're going to check for symptoms of TMJ. We're going to ask the patient to open and close their mouth. Okay, no clicking noted. We're going to wrap around and check for thyromegaly. We're going to ask the patient to swallow. Check for nodules at the same time, normal. And then we're going to check the midline of the trachea and swallow again. Excellent. Okay, and we're going to continue by assessing your cranial nerves. First, we're going to check cranial nerve number 5, which is the trigeminal nerve. Okay. I'm going to utilize a Q-tip. I'm going to ask you to close your eyes. Can you feel that?
Yes.
Okay, can you feel that?
Yes.
Okay, cranial 5 trigeminal is intact. We're going to assess the cranial nerve number 7, the facial nerve. I'm going to ask you to close your eyes. Okay. Open them. Smile. Frown. Okay. Cranial nerve number 7 is intact. Now we're going to check for cranial nerve number 12. We'll do a rhyme. You need to say line, time, crime.
Line, time, and crime.
Okay. Cranial nerve number 12 is intact. Now we're going to check for the lymph nodes. First, we're going to check for the posterior auricular. Work our way down to the occipital. Work our way back up. And assess the submandibular and the submantle. We're going to work our way down and assess the anterior superficial, also the posterior superficial. Work our way down to the... Now we're going to conduct a skin assessment. Skin is warm to touch, no pallor noted, no lesions. We're going to check for capillary refill. Normal is less than 3 seconds. Now we're going to check for pitting edema in the lower extremities. No edema noted. We'll check for cranial nerves number 3, 6, and 7. That's oculomotor, trochlear, and the abducens. By going across, please follow the light. Perfect. We're going to go up and down. Good. Now diagonal. Good. Good. Now we're going to check for the corneal reflex. Good. Now we're going to do the perla. Pupils equal, round, reactive to light, and accommodation. That's the ear. We're going to check for tenderness of the tragus. There. Okay. We're going to check internally by pulling the ear up and outward. Tympanic membrane is intact. No erythema, no swelling noted. No tenderness of the tragus. How's that? No discoloration. Check inside. Tympanic membrane is intact. Now we're going to inspect the nose. Okay, septum is patent. No redness, no swelling, no polyps noted. Check left nostril. No redness, no polyps noted. We're going to check for patency. The patient is going to hold their right nostril and blow out through their left. And they're going to hold their left nostril and blow out through the right. No septal deviation noted. Now we're going to go straight into the oral cavity. And need you to open your mouth. We see here no lesions, no swelling of the tonsils, no swelling of the tongue. Good dentition. And now we're going to say ah. Okay. Uvula is centered, and that says the glossopharyngeal cranial nerve. Check for labored breathing and dyspnea. Any abnormal breath sounds. We're going to inspect for masses. No masses noted. Okay. No tenderness reported by the patient. Now we're going to check for fremitus. The patient will recite the word 99 3 times.
99, 99, 99.
Now we will percuss. And go lower for CVA tenderness. Now we will auscultate for any abnormal lung sounds. Okay. Good. No rhonchi, no rales, and no wheezing noted. We're going to auscultate the carotid artery for any bruits. No bruit noted in the right carotid. No bruit noted in the left carotid. Auscultating for tracheal breath sounds. Tracheovestibular breath sounds. Now on the second intercostal space on the right side, we're going to auscultate the aortic and pulmonic arteries. Now we're going to assess S1 and S2. Let's look in the fifth intercostal space, midclavicular line. That is the lumped up sound. That is closure of the tricuspid and mitral valves. Now we're going to switch the stethoscope to the bell side and assess for S3, S4. No S3, no S4, and no murmurs noted. Now we've positioned the patient in supine to conduct the GI assessment. First, we're going to inspect for any bulges, any skin discoloration, and now we will palpate for any tenderness, starting at the lower right quadrant. We'll work our way up to the upper right quadrant. Working our way over to the upper left quadrant. The patient is quite sensitive in that area. And we'll work our way down to the lower left quadrant. Excellent. And now we will listen for vowel sounds. Switch it back to the diaphragm. Work our way up to the upper right quadrant. Upper left quadrant. Lower left quadrant. Normal active bowel sounds, and I reposition the patient in the chair to assess the extremities, range of motion, and resistance. We inspect the shoulder, the elbow joints, the wrists, the knees, the ankles. We're also going to palpate for the dorsalis tibius, and this one's called pulses, dorsalis pedis, which is on top of the foot, the radial pulse, we're going to do range of motion resistance, starting with the wrists, upward, inward, good, up, good, down, good, shoulder, up, down, good, good, neck, good, to your left, good, to the right, good, forward, good, back, good, knees, push up, good, forward, forward, left ankle, outward, abduction, adduction. So now we'll be conducting the neurological testing. First we will check reflexes, the upper extremity, check the brachioradial reflex, one, support the hand, good enough, that's two, check reflexes for the lower extremity, the patella area, that's one, and two. Now we will do the cerebellar test of rapid movement. You're going to bring the hands up, and you're going to rotate them back and forth rapidly. Okay, perfect. The Romberg's test, patient will stand. She will close her eyes. The toe test. Okay, please walk towards me on your heels.
On my heels?
Yep.
First? Okay.
Okay, good.
Okay.
Now you will walk back the other way on your tippy toes. Perfect. That concludes the head to toe assessment.